Today we're diving into a story about a huge gap. A gap between a promise written in a country's constitution and the hard reality on the ground. We're talking about the healthcare crisis in Guatemala and the incredible community response to it. So let's start with that foundational promise. I mean, it's right there in black and white. In Guatemala, healthcare is a guaranteed right for every single citizen. That's the starting point.
But, a right on paper is one thing. To make it real, it needs resources. And this number, $97? Well, that's how much the government spends per person each year to make that constitutional promise a reality.
Now, to really put $97 in perspective, just look at this comparison with the United States, a place where healthcare isn't even an explicit constitutional right. The difference is just massive, and it's what leads to a system that's chronically underfunded, understaffed, and often missing the most basic supplies.
So, what does a funding gap like that actually look like for people on the ground? Well, it creates this deep, dangerous divide, especially between those living in the city and everyone out in the countryside.
And wow, this chart just says it all, doesn't it? An incredible 80% of all doctors in the entire country work in one single place, Guatemala City. That leaves just a tiny fraction, only 20%, to care for everyone else.
This raises the big critical question, right? If you're part of the huge majority of Guatemalans who don't live in the capital, what are you supposed to do when you get sick?
Well, the reality is a series of almost impossible hurdles. First, you have to travel, often for hours. That means taking days off of work, unpaid, which most people just can't afford. In some regions, like Alta Verapaz, almost a quarter of the people are more than an hour away from even the most basic clinic. And then, even if you make it there, you might not be able to communicate. There are 25 different languages spoken in Guatemala, but most specialists, they only speak Spanish.
And these barriers, they have devastating life-or-death consequences. Just look at the data on maternal mortality. The rate for Indigenous women is more than double that of non-Indigenous women.
Let that sink in. 68% of the deaths from just 43% of the population. This isn't random. It's a clear, heartbreaking sign of a systemic failure to provide accessible and culturally appropriate care.
But this is not just a story of crisis. In the face of all these challenges, an incredible picture of resilience emerges. You have communities, nonprofits, and local heroes all stepping up to fill the void.
To really see what this looks like, let's zoom in on one person's story. This is Maria Candelaria Schock. She's 82, her health was getting seriously worse, and like so many in her remote village, there was just no doctor she could get to.
And then, a mobile clinic run by Choice Humanitarian and the Red Cross came to her village. A doctor saw her, immediately diagnosed a life-threatening problem with her glucose levels, and took action. They gave her an IV and medication right there, on the spot, and stabilized her condition. They literally brought the healthcare to her.
Now, mobile clinics are absolutely vital, but what about ongoing care? Let's look at another powerful approach. In the community of Aldea Pitzal, Dr. Eliseo Pelico runs the only 24-hour urgent care clinic in the entire region. He's a permanent anchor of health.
And this right here, this is the game changer. A consultation with Dr. Pelico costs about $3. Compare that to a typical private clinic, which might charge $40. When your family lives on less than $2 a day, this is the difference between seeing a doctor and not.
But it's not just about the cost. Dr. Pelico speaks Quiche, the local Indigenous language. He removes that communication barrier we talked about. This means he can provide care not just with medicine, but with dignity, with clarity, and with real understanding.
So these local solutions are just incredible lifelines. And they're actually inspiring a new wave of thinking, a push to move beyond temporary fixes and towards building something bigger, a system based on transnational solidarity.
Okay, so let's look at this new model. Enter the Pan American Medical Association, or PAMA. They formed just this year, and they zeroed in on one of the biggest problems, the broken supply chain that keeps essential medical gear from reaching the people who need it most.
And here's what's so smart. To make sure they're actually making a difference, PAMA created its own metric, the Solidarity Supply Index. It's not just about counting boxes. It tracks everything. The weight of supplies, how many people they reach, and maybe most importantly, whether the aid is ethically aligned with what the community actually needs. And they've already put it to the test. PAMA scored an 8.7 on its own index. How? By successfully cutting through all the red tape
to deliver over 2.5 tons of critical medical supplies to a major trauma center in Havana.
But PAMA knows it's not just about supplies, so they're also completely rethinking how direct medical intervention happens on the ground. And their big idea is something called Solidarity Medical Impact Teams, or SMITs for short.
Their process is designed for speed and, crucially, integration. A small, nimble team gets on the ground and figures out what's needed within 24 hours. By day 3, they're not just working nearby, they're working with the local health system. And all along the way, they're tracking data to make sure their impact is real and that it lasts.
Which brings us to this final, powerful question. When you look at all these stories, from Dr. Pelico's clinic to PAMA's global teams, it feels like a fundamental shift is happening. It challenges us to think beyond the old models of charity and ask, what if the future of global healthcare isn't about aid, but is actually built on a foundation of genuine solidarity?